keep going. So here we have the 7 dwarves of menopause. Welcome to the class, by the way. This is a master class to help women understand what's going on with their bodies during menopause. This is a huge subject. I am simply, in today's master class, going to give a high-level overview of menopause. And if you are interested in taking a deeper dive and learning more about it and what you can do about it and why it's so important to understand the stage that your body is in order to protect it for the future, then I will be introducing a course that I have just developed at the end of this masterclass. So, what's menopause? It's derived from the Latin root for what the fuck is happening to me. The time of life where a woman doesn't know if she is coming or going, on fire or freezing, happy or sad, wants to diet or eat everything in sight. Common phrases used during this time include muffin top, hot flash, mood swing, brain fog, and women in menopause may self-medicate with wine and chocolate and vodka and ice cream, lots of carbs, lots of new shoes, online purchases, Netflix, or just looking at a picture of Sam Elliott. Okay, so we're going to go through these 7 dwarves of menopause one at a time. We have itchy, we have bitchy, we have sweaty, sleepy, bloated, forgetful, and psycho. My very favorite one. So let's talk about itchy. Okay, why is your skin so itchy? Why has the skin in your vagina gotten so fragile? Well, it's because we aren't producing the estrogen levels that we are used to having in our body. After the age of 35, our ovaries basically go into retirement, or they start heading in that direction, and they reduce their production of estrogen and progesterone. So estrogen and progesterone are kind of a yin and a yang. In other words, they kind of balance each other out. But unfortunately, when you start into the transition of menopause, not only do both of those hormones decline, but progesterone declines at a much faster rate. So not only is your body not having the same amount of estrogens and progesterone that it used to have, but now it also has this estrogen dominance, meaning you have that estrogen progesterone balance is out of whack and you have way more estrogen than you do progesterone, which leads to the hot flashes and all of these different symptoms. So the reason why your skin is dry is because you have a lot of estrogen receptors in your skin. So your skin will get dry. You'll start losing collagen, which is what gives your skin the basically structure. It holds the layers of the skin together. And so when you're losing collagen, you're starting to get the little jowls here and the little neck here. So that is all related to our estrogen and progesterone levels. Okay, now we're going to talk about bitchy. So there are areas in our brain where we process our moods. So it's in charge of our feelings of depression, our feelings of anxiety, our mood swings, rage, emotions that some women have never, barely even ever experienced before are now kind of taking them over. So when your brain doesn't get the estrogen it needs, these are the symptoms that you have to deal with. Okay, now let's talk about sweaty. So sweaty is because the area of your brain that regulates your body temperature also isn't getting the estrogen that it needs, and as a result, you're having hot flashes. You're waking up in the middle of the night with night sweats. It's because your body temperature is is not being regulated very well because your estrogen isn't getting up to your brain. So your body raises its temperature, and then to cool itself off, it creates sweat on your skin so that when the air hits the sweat, it cools down your body. Uh, so then, um, so the symptoms and duration of your hot flashes, and that's not just heat, it's like from here up, and you just feel like you're burning. And it can also cause rapid and irregular heartbeats. It causes pressure in your head. And it can last anywhere from 30 seconds to 5 minutes. And it can happen up to 20 times a day and last for as long as 14 years. So some feminists describe hot flashes as power surges. Well, it's more like being possessed by a demon and incinerated alive. Okay, so now we have talked about itchy, bitchy, sweaty. Let's talk about sleepy. So, there's an area of our brain that regulates our sleep and our circadian rhythm. And again, with inadequate estrogen, it starts going haywire. And you may experience difficulty falling asleep, or you may experience difficulty staying asleep, or both. You may wake up because of your night sweats, and you've soaked through your nightgown and your sheets, and or you have to, you're urinating more frequently. All of these things contribute to sleep disturbances. Okay. Now let's talk about bloated. So bloated can mean not only the retention of fluids in the body, which makes you all puffy and your eyes are puffy and all of that, but also I'm referring to the weight gain, especially around the middle with the belly fat, which is directly correlated to your cortisol levels. And so it can be one of the most distressing aspects of menopause. I have a whole course just completely focused on, what's going on with all the belly fat and how to get rid of it once and for all, and to get off of that dieting roller coaster. If anyone's interested, I'll tell you more about it, but just know it's a very comprehensive explanation and action plan for managing this aspect of menopause. So let's talk about forgetful. Again, an area of our brain that has to do with our memory consolidation, not to mention that sleep is when the brain is able to consolidate memories and get rid of toxins. So when you're not sleeping, you can't consolidate those memories and the toxins can build up. Which can be another risk factor for Alzheimer's disease. So Alzheimer's, 2 out of every 3 patients with Alzheimer's are women. We have a much, much higher risk of Alzheimer's than men do, and it's specifically related to our fluctuating hormones. So in order to protect your brain, you really need to focus on balancing your hormones and supporting your body through this transition. So here's an example of what women frequently feel. I am Wonder Woman. I wonder where my keys are. I wonder why I went upstairs. I wonder where my mind has gone. I wonder who will annoy me today. And the biggest lie I tell myself about menopause is, I don't need to write that down. I'll remember it. Yeah, not. So now we are on my very favorite one, which is the psycho bitch. So with all of this stuff going on, the hot flashes, the mood swings, insomnia, night sweats, did you really just ask me to put down my wine? Well, actually I am, because wine just puts fuel on the fire and makes everything worse. It disrupts your sleep. It pumps you full of sugar. Elevates your cortisol levels. It can cause fatty liver disease, all of these things. So, and I'm not against an occasional glass of wine. Unfortunately, at this age is when women really kind of start increasing their consumption of alcohol, and they're trying just to feel better, but it's actually making things worse. So that's why it's so important for women to understand that there are things you can do that are going to help you feel a lot better than you do. Okay, so okay, so this is your time. What I'm trying to do now is move you from menopause is horrible, I feel like crap, I hate everybody and everybody hates me, over to, wow, there's a lot I can do. It's already making me feel better. I'm starting to look better. I'm feeling more like myself again. So that's the transition we're going to be going through today. So understand that this, although you have a lot of physical things going on, this is your time. It's like Mother Nature is saying, it's almost forcing you to start putting yourself first instead of taking everybody else before you take care of yourself, and really tuning into your body, stopping to think, how do I want the rest of my life to be? And, you know, capturing that and running with it. So this can be considered the beginning of a new journey in your life. You're done with child rearing, or you're getting close to being done with child rearing. And it is possible to embrace this phase of life and to minimize the stress in whatever form it comes in. So you really can make the best of this time by being introspective, by deciding what's important to you, what you want to do from here forward. And most importantly, now is the time you really need to start making good choices. And I'm talking about your physical and mental health, because these good choices are more important now than they have ever been, because it's at this stage when women start having to deal with serious illnesses such as heart disease, cancer, pelvic floor issues, bone health, orthopedic issues. And the more you understand how to support your body and you take the appropriate steps to give your body what it needs during this very tumultuous time, the better your future health is going to be and the easier this transition will be for you. So that's our focus for the rest of this masterclass. So I like to hone in to people and make sure that they understand that they are 100% responsible for what the results are. In other words, everything in your life is a reflection of a choice that you have made. And if you've been making certain choices and you don't like where you have ended up, then if you want a different result, you have to make a different choice. So that's what we're going to be going over, and I'm going to be narrowing it down into things that are the most important for you to, number one, be aware of, and number two, start making really good choices about. So now is the time that you want to protect your heart. Heart disease is one of the number one killers for women, and midlife is associated with these rapid aging processes that bring up all of these different health issues. And the number one are heart and vascular issues. So when you have made choices that have resulted in an excess accumulation of plaque that can lead to blood clots either in your heart or in your brain or in your legs, they can be life-threatening, and that usually is a result of poor diet, of obesity, of lack of physical movement, elevated blood pressure, diabetes, and smoking. If any of you out there are smokers, that's your number one thing to tackle because your body isn't as strong as it used to be. I'm an ex-smoker. I smoked for 15 years. I don't smoke anymore. I haven't smoked for 30 years, 35 years, something like that. It's very difficult to quit. Very, very difficult. But if you're wondering where to start, that's where you start. And another thing to consider is that the chances of having a heart attack in women is higher if you started menopause earlier. So menopause generally happens at age 51. That's the average age of menopause. So what is menopause? Menopause means that it marks the 1-year anniversary of not having a period or any spotting or anything for 12 months prior to that date. Once you hit that 12-month mark, that's menopause. It lasts for 1 day, and everything after that is postmenopause. Everything before that is perimenopause. So if you went into early menopause, you really need to be cognizant of your heart risks as a result. And, you know, men and women have different hearts and they experience symptoms differently. Whereas men will often complain of pressure in their chest, women will complain of back pain. So it's important to know and be able to recognize what the symptoms of heart disease are so that you can prevent the disability and even death. So now is also the time where you're going to want to reduce your stress. So stress at this time of life is or can be horrendous. You may have aging parents that are having health issues. You may be having your own health issues. You may be having relationship problems with your husband, with your kids, with people at work. Your work performance may be suffering because you're having this brain fog and this irritability and depression and you can't seem to get things done. So you put all of those things together and you extend it out over a long period of time, and that creates such havoc on your body. It can lead to what's called adrenal fatigue, meaning your adrenal glands that normally produce your cortisol, epinephrine, and adrenaline, which are your stress hormones, has been working so hard because you've been under so much stress for so long that they basically crap out and they're like, oh my God, I can't keep up with this. And so you go from elevated levels of cortisol on a chronic level to burnt out adrenal glands. And now you have low levels of cortisol, which cause its own set of problems. So if you can do anything, then I would, number one, stop smoking, and number two, start managing your stress better. And there are all different ways that you can do that. And again, I can, I go into all of this stuff in the course. Um, but so, and these elevated levels of cortisol can also result in atherosclerosis, which is basically the narrowing of the arteries and the stiffening of your blood vessels. And so in order to protect your heart, you need to reduce your stress. And now is the time you're going to want to start paying attention to what's called metabolic syndrome. That's a constellation of conditions that include high blood pressure, high blood sugar, obesity, diabetes type 2, and elevated triglycerides and dysregulated cholesterol. So if you have one of these conditions, let's say you just have high blood pressure and none of the other things, then you still are at increased risk for developing heart disease. But if you have more than one, if you started off with high blood pressure and now your blood sugars are kind of creeping up and your hemoglobin A1C is going higher rather than staying stable, then that's a sign that you're starting to get into metabolic syndrome, which is the leading cause of heart disease and death and morbidity in the United States. In fact, 1/3 of US adults have metabolic syndrome, which is a very sorry state of affairs. And if you do have more than one of these symptoms, you need to consider aggressive lifestyle changes in order to either delay or prevent the development of very serious health issues. So what is it that increases your risk? Number one, your age. The older you get, the more likely you are to start developing this constellation of problems. Ethnicity. If you're Hispanic living in the United States, you have a much higher rate of developing metabolic syndrome. Obesity, okay? Obesity causes metabolic syndrome, diabetes, and other diseases like non-alcoholic fatty liver disease, which is a direct result of eating too much fructose and the cause of why we have such a huge increase in liver transplants in this country. Other issues can be polycystic ovarian syndrome and sleep apnea. So another major issue with menopause is depression. So it is a significant risk factor in the development of heart disease. Depression causes your elevated stress levels, which cause your blood pressure to become elevated, which makes your heart rate beat faster. And, if you are dealing with all of these physical and these emotional issues and all of these stresses, it can really become overwhelming. And 1 in 5 women will experience an episode of clinical depression in her lifetime. And unfortunately, less than half of them will seek treatment. And that is a very sorry state that our country has such a stigma against mental health. I mean, consider the world we're living in. If it didn't bug you at some point, it would be, I don't know what you would have to be to not be affected by everything that goes on around us. So, and depression affects women at least twice as often as it affects men. And our appearance plays a huge part in that. So as we start to gain weight, as our skin starts to sag, as we start losing confidence in ourselves, in our abilities at work or at home, or our sex appeal with our mate, etc., that has a huge effect on our mental health and can cause depression. Now, unfortunately, depression increases our risk of dementia, Alzheimer's disease, eating disorders, sleep disorders, anxiety, bipolar, etc. So, women have a much higher risk of Alzheimer's, which I've already talked about. Now, with depression often comes suicidal ideation. So in 2009, there was a study in Europe, and they found that women who were going through the transition into menopause had a 7-fold increase in the risk of suicidal ideation. So suicidal ideation is you're thinking about it. You're starting to have these dark thoughts like nobody would miss me or whatever, however it showed up for you. And it can be a very scary time. And if you are experiencing those kinds of thoughts, please don't let this this irrational stigma against mental health stop you from seeking treatment, because there is treatment available and it's not your fault. So please take care of yourself. And the dysregulation of your ovarian hormones also plays a huge effect on that. Now it's time to prevent cancer. Okay, cancer is another major health risk for women at this age, particularly breast, ovarian, and cervical cancer. And of course, cancer can happen at any age, but it is more likely to hit women during this menopausal transition, and it's specifically related to varying hormone levels. So now is also the time to prevent pelvic floor and bladder issues. So protect your bones. Here's some joint disorders. Hormone replacement therapy.